Welcome to Better Care Brief, where we bring together healthcare leaders, innovators, and changemakers who are shaping the future of healthcare. I'm your host, Gigi Kurian, founder of Harmony Thrive AI. Today, it's my pleasure to welcome Dr. Scott McNabb, president of Public Health Practice. Throughout his distinguished career, Dr. McNabb has been at the forefront of public health surveillance, health informatics, and global health initiatives, working with organizations including CDC and WHO to improve health outcomes worldwide. In today's episode, we will discuss the next chapter in healthcare consulting, moving past market volatility, and explore how innovations, collaboration, and responsible AI can help build the next generation of intelligent public health. Dr. Scott, welcome to Better Care Brief.
Thank you, Gigi. It's a pleasure to be on your podcast, and I want to thank you for all the work that you're doing for the community. Thank you.
You're welcome. It's my pleasure. Scott, you have worked with government and healthcare organizations through different economic and public health cycles. Today, organizations are dealing with financial uncertainty, workforce shortages, changing regulations, rapidly evolving technology which we can't even keep up. From your perspective, what has fundamentally changed in what healthcare organizations need from a consulting partner compared to, say, 10 years ago?
It's a very good question. Right now, we're in what I call a shaking. That means all of the elements that you described, the changing political nature, the policy changes. As you probably know, the US CDC celebrated its 80th anniversary in June, and there have been at least 25% layoffs or cuts at the US CDC. And of course, we just saw Dr. Fauci on being in testimony at Congress. So there's a shaking. And I teach at the University of Georgia as well as at Columbia University, and my students, are all freaked out. They were entering into the field of public health, especially wanting to go into the field of what's called public health surveillance. And they're asking me, Dr. McNabb, is this really, maybe we should choose a different field. Maybe this isn't the right place for us to enter into the workforce. And so I tell my students, take a deep breath, step back, and let's think about how we can make things better. Sometimes a shaking can provide, and this is the case, I believe, for an opportunity to put forward a new and better pathway for what I call developing a modernized public health ecosystem.
In your opinion, what are the top one or two challenges your clients consistently bring to you today?
Yeah, well, my job as an epidemiologist, and I've been in the field of public health for 40 years, as you mentioned, 20 of it at the US CDC and 13 years at the Oklahoma State Health Department. So I've been on the front row, at the district and state level, as well as the national and international level in public health practice. Right now, as you know, also we have many infectious disease problems that have been reported that are ongoing, and many of those are even what we call One Health diseases, like Rift Valley fever and mosquito-borne illnesses and so forth. So we need to be thinking about a better way to do what I call public health surveillance. Now, the word surveillance has sort of negative connotations. So we've been thinking about using the word intelligence, but the word intelligence also is a little bit shaky. Basically, we have to, as public health officials, at the local level, the county level of the United States, for example, those epidemiologists need to know what's happening and when it's happening. They have a different workflow process than healthcare services. So let's say you take your daughter has fever and night sweats. You take her into the doctor. The doctor is examining her and asking a few questions, and he or she is entering that information into the electronic medical record. And he said, your daughter may have measles. We have an outbreak of measles right now, as you know. So please take her to the laboratory. Well, what happens is that, and when I was at CDC working with the team at in Boston, we conceived the idea of abstracting public health reportable conditions from the electronic medical record, and we thought that was a great idea, but it actually has not worked in the last 20 years. So we're proposing a new system, a new way of, I call it the ecosystem, public health ecosystem, where we use artificial intelligence. And to answer your question, AI is one of the key elements of how do we think about a better way forward. We have a concept that we can use AI sort of as a module on the back end of that data entry platform. So the doctor who's required to report measles to the county health department, it's a part of a legal responsibility that he or she has because it's one of the reportable conditions. He has to go through a second data entry, or his staff have to come in and review the records and try to get the information to the local public health authority. We believe that we can use what I call ethical generative AI. By ethical, I mean that we want to make sure that we maintain privacy with all of the data that belongs to an individual. We don't want that health information to escape or to be released to anyone or any unity that doesn't have authority for that. But with AI, we can identify if a information that's being entered into the electronic medical record is a reportable condition. If it's measles, then AI can abstract and convert that information into an appropriate format, like a line list or an epi curve, and send that information immediately to the public health official at the local level and the state level and then the national level as well. We live in a country that is, the Constitution has regulated health care services and public health to each state governor. So each state has its own authority, so to speak. But they have to work together because we have to look at this from a national level. So the answer to your question is using ethical generative AI, we believe we can reduce the burden on the provider of healthcare, meaning data entry once. They only have to enter the data one time. With the AI module on the other side, the information can be, if it is a reportable condition, can be captured, translated into the right format, and presented to the public health official where they have the information they need, when they need it, where they need it. I've spent quite a bit of my time working in Africa. We help support the Africa CDC stand up the Institute for Workforce Development. You mentioned training. We have developed what I call the best practices for multi-communication online e-learning. We hosted 4 courses through the Africa CDC throughout the continent of Africa. So we work closely with in the Middle East with a variety of different stakeholders. When I was at Emory, we had 2 5-year contracts to support the development of masters in public health for Emory physicians and medical professionals. So we would bring them to Atlanta and they would train in their master's in public health degree using data from Saudi Arabia as their theses and then go back home. We sort of joke that we have about 25 Atlanta babies, children that have been born in Atlanta to our students. And I joke with my students because they say that they speak English better than Arabic. So we build bridges in this way. And education, I teach at Columbia online, teaching online courses at Columbia. We have now with Starlink, we want to create an environment where everyone has easy internet access. And we believe that we can deploy Starlink throughout Africa to facilitate this sort of communication and training.
So, in short, you're bringing together surveillance, informatics, monitoring and evaluation, education, and strategic planning.
That's right.
If you were to design a healthcare consulting from scratch today, knowing everything we know about technology, data, and AI, of course, what would you build differently?
Yeah, we have the concept, we're trying to develop a global model, a model not only useful in the United States, but we work very collaboratively with teams in Pakistan and the Middle East and also in Africa. A model that WHO could adapt as the global standard. We did that in the year 2000. We developed what's called Integrated Disease Surveillance and Response, IDSR, which became the WHO model. It's the standard for Africa, WHO Afro, all of the WHO programs. That looks at public health surveillance from a different point of view, not just the disease du jour or the disease of the day, but looks at the system. In the United States, one of the changes is that the US CDC, medical professionals go through medical school, they decide, oh, I'm going to become an infectious disease specialist. And then they choose, oh, I'm going to become a TB specialist. I'm going to become an expert in TB. So the US CDC evolved over 80 years into a large government agency in silos: TB, HIV/AIDS, hepatitis, etc. Each division director would go to Congress, get money from Congress to support their program, and they wouldn't be looking at integration. Could there be, the fact is that any institution, private company or government institution, after 80 years of growth, ends up growing into some level of inefficiency. And I think that's exactly what's happened to the US CDC. So the shaking that we're experiencing can be a good thing. It's an opportunity for us to look at a better way to move forward. And we believe we have the pathway for that. This idea of establishing a modernized public health ecosystem, which includes One Health, it includes veterinarians, veterinary laboratories, it includes pharmacists. If you get a stomach ache, let's for example, and you go into the pharmacy rather than going to the doctor. We have an outbreak of salmonella right now in the United States too. You may pick something off the shelf and you eventually get better. So you're never seen by a doctor. So we need to include the data point in the pharmacy, also wastewater treatment, et cetera. There are many points of data collection that the modernized public health ecosystem needs to address. So we want to do something better, faster, cheaper, and use modern information technology to provide the information needed when they need it and where they need it. That's the goal.
I can see this happening in near future or in coming 5 to 10 years. I think this is going to get big. Everyone is talking about AI today. But I think the more interesting question on the table is not whether organizations should use AI, it's where AI can genuinely make a measurable difference. Based on your experience helping public health organizations around the world, where do you see AI creating the greatest opportunity over the next 5 years?
That's a very good question, too. And again, I come back to ethical generative AI, meaning the AI that's created must be ethically oriented. But imagine that the doc we work with in Pakistan, imagine you're a primary care doctor out in the in the community in Pakistan, and you have patients that come to your service, and your charge is to develop a differential diagnosis. What if we use AI to help the doctors determine, based on the client's symptoms, etc., what the most appropriate differential diagnosis should be? In other words, AI can capture all kinds of information and provide the doctor with an outstanding review of what the patient has. Then AI can also provide the doctor with the very best recommendations for the services to the patient. What antibiotics or what other type of clinical support would this patient need? So AI can facilitate primary health care in this way, but also on the side of the data entry, it can facilitate not only the management of the patient's needs through healthcare services, but also this idea of creating this modernized public health ecosystem, because public health has a different workflow. It's not treating the patient, it's looking at the signs and symptoms and the information needed to determine, is there a public health emergency? Is measles being spread? Is there a case in this particular circumstance that may be infectious that we need to maintain protection for that individual? Those are the those are the challenges that face public health and healthcare services. So it can be used in both settings, both healthcare services as well as public health practice.
Could AI become another member of the public health team, handling routine analysis while allowing experts to focus on complex
Yes.
decision making?
Yeah, exactly. Now, we have to, you said a team member. So it's not an individual. We should manage it. We should have the control of it, et cetera. We don't want, I think you've also seen, there's been some discussion about would AI sort of get out of control and could it become its own entity? We obviously don't want that to happen. So we have to make sure we have the control button on it. But it can be a facilitator, as you mentioned, of data analyses and data presentation, help us in a much better way, quicker too.
So we are entering in an era where AI can continuously monitor information, surface emerging risk, and support leaders and practitioners with recommendation before they even been asked. It will be fascinating to see how organizations adopt those capabilities responsibly, right? How do you see that evolving?
First of all, we have to understand what AI is, how it's managed, et cetera. So it needs to be taught in public health schools and medical schools, meaning that the young investigators who are interested in going into medicine or public health have an opportunity to learn more about AI, to learn about information communication technology. How do we use these tools to facilitate our work? So education is one of those elements. We have to make sure that we have the right training and that's provided in the proper way, first of all. Then we need to test it. We're all scientists, so we believe that we should be doing what I call applied research studies. Do a study that may, as you mentioned, between say 2 and 5 years, that with a monitoring evaluation plan and indicators that showcases that what we're proposing to do is really better than it was before. And we identify any issues or problems in advance. So as scientists, we can manage that through our applied research studies.
As we wrap up, I would like to look ahead and focus on the consulting part. 5 years from now, Dr. Scott, what capabilities do you believe every healthcare consulting organization will need if they want to remain relevant in an AI enabled world?
First of all, is to understand AI, understand the value of it, also the challenges that we face with it. Make sure that we also understand the ethical components of it. We want to make sure that the information that's collected on patients or public health individuals is protected. We don't want that to be released. So I think having a good understanding of it and thinking about the value of it and then implementing it in a way that can be tested becomes the pathway forward, in my view. And that means staying on top of it. I believe that we should be able to create a global environment where everyone has easy internet access. I lived in North Carolina right after the hurricane. Our county was one of the impacted counties. So I installed Starlink in my home, and it was wonderful. Starlink is being used now in Ukraine during their conflict with Russia. And I think we could put forward a proposal to establish Starlink throughout the world, but also certainly in Africa and the Middle East, where we can use it effectively for healthcare services and for public health purposes.
Scott, this has been a fantastic conversation. I appreciate not only your decades of experience, but also your thoughtful perspective on how healthcare consulting continues to evolve. One thing that stood out to me is that while technology, including AI, will undoubtedly help transform healthcare, lasting success still dependent on strong leadership, trusted partnership, and thoughtful implementation. Thank you again for joining us and for sharing your insights.
Oh, it's my pleasure, Gigi, and my best to you. Thank you for what you're doing for the
Thank you.
community. And I want to thank all of your constituents as well for listening to this podcast. We're eager to do the right thing for the right reason for the right people.
Listeners, thank you for spending time with us today. If you enjoyed the conversation, please feel to put on your comments, subscribe. Until next time, I'm Gigi Kurian signing off. This is Better Care Brief.
Thank you.